they have nothing. Let's look at the numbers. Sweden has 15,322 cases of COVID. They did 74,600 tests, which is 21%, similar to the other countries. 21% of all those tested came up positive for COVID. What's the population of Sweden? About 10.4 million. So if we extrapolate out the data, about 2 million cases of COVID in Sweden. They did a little bit of social distancing. They would wear masks and separate. They went to schools, stores were open. They were almost about their normal daily life with a little bit of social distancing. They had how many deaths? 1,765. California's had 1,220 with isolation. No isolation, 1,765. We have more people. What I'm getting at is millions of cases, very small death. Millions of cases, very small death. This is what we're seeing everywhere. Norway, its next door neighbor. This is where I come from. These are two Scandinavian nations. We can compare them as they are similar. Let's look at the data. Norway, 7,191 cases of COVID. Total COVID tests, 145,279. So they came up with 4.9% of all COVID tests were positive in Norway. Population of Norway, 5.4 million. So if we extrapolate the data as we've been doing, which is the best we can do at this point, they have about 1.3 million cases. Now their deaths as a total number were 182, fairly small, but statistically insignificant from 1,700, you realize. Millions of cases, small amount of deaths. 1,700, 100, these are statistically insignificant. So you have a 0.003 chance of death as a citizen of Norway and a 97% recovery. Their numbers are a little bit better. Does it necessitate shutdown, loss of jobs, destruction of the oil company, furloughing doctors? That's the question I have for you. And I think the answer is going to be increasingly clear as we move through this data.
And now here's where it gets real. All the numbers worldwide are virtually the same, okay? There's some slight variations, but what hasn't been taken into account, and what Fauci and Birx and Gates didn't take into account, is the impact on the health system in other sectors, okay? The suicides, the people who, the alcoholism, the drug use, and the side effects of the self-quarantining, and what it's doing to the communities across the country and across the world. Listen.
The next thing I wanted to talk about is the effects of COVID-19, the secondary effects. COVID-19 is one aspect of our health sector. What has it caused to have us be involved in social isolation? What has it caused that we are seeing the community respond to? Child molestation is increasing at a severe rate. We could go over multiple cases of children who have been molested due to angry family members who are intoxicated, who are home, who have no paycheck. These things last a lifetime. This isn't about a seasonal flu. These are things that will follow these people and affect them in a negative fashion for their life. And these are secondary effects from COVID. And these are for me talking to ERs, talking to my doctors, and talking to people across the country and finding out what they're seeing. Spousal abuse. We see people coming in here with black eyes and cuts on their face. It's an obvious abuse case. These are things that will affect them for a lifetime, not for a season. Alcoholism, anxiety, depression, suicide. I talked to Donnie Youngblood and various people in the community, and I've asked them, how are things going? Suicide is spiking. Education has dropped off. Economic collapse. Medical industry, we're all suffering because our staff isn't here and we have no volume. These are all real things that I'm seeing every day. I don't read about this stuff. I'm seeing it in my clinics. We have clinics from Fresno to San Diego, and these things are spiking in our community. These things will affect people for a lifetime, not for a season. So let's make sure we're clear on that.
So what he brought up there, I think, is probably one of the most important things, the most important pieces of data that we can consider here, is all the secondary effects of the policies that were put forth and presented to Donald Trump from Fauci and Birx, and the impact that it's having across the country. I mean, child abuse, spousal abuse, All these things are up. Education is down. I mean, all these things having a ripple effect across the world because they had projected numbers that were absolutely wrong. Now listen to this. This is, I think, I'm going to close this out after this clip, but this is where he compares the flu numbers to COVID-19. Now remember, this is also part of the messaging we heard early on, that it was no more dangerous than the flu. And now as the more and more numbers are coming in, we're finding out that to be true. Listen to this.
Now I want to compare flu virus. Is this significantly different? And I just got a little bit of data here. So deaths, per the CDC, 24,000 to 62,000 deaths each year. We had about 45 million total cases in 2017 with about 62,000 deaths, or a 0.13 chance of death from flu in the United States. As you know, our other numbers were 0.02. So the lethality of COVID-19 is much less. Now you've got hotbeds of it in New York, but again, we went over the numbers. 0.1% chance of death. Widespread, small amount of deaths. It's similar to flu, as a matter of fact. If we follow the science, as we've been asked to do, I'm following the science. This data is generated by the CDC, World Health Organization. The testing is generated by what we have done here. So we are following the science.
Follow the science. That's the answer here. And the science speaks for itself. Sadly, the science that was presented to Donald J. Trump, our president, by Fauci and Birx at the onset of this pandemic, that science was wrong. And now people are out of work. 26 million people out of work? Think about all the side effects we just talked about with the suicide rates. Just that alone. I believe that Fauci and Birx presented an option to the president. Either you go ahead and you shut down the economy, you issue the stay-at-home orders, you tell people to initiate social distancing, you tell people all these things, and yes, you will sacrifice your beloved economy, President Trump, the economy that he has been so happy about for so long. You will have to either sacrifice that or 2 million American lives. And what did the president do? He doesn't want to kill Americans. He doesn't want to see Americans suffering. He had no choice, a rock and a hard place, and he had to sacrifice the economy. That was a sad decision, but he had no choice. He was presented with faulty data, false projections, and then panic driven by the media and pushing all of our elected officials up against the wall to react. And now you have, there's ventilators that are not even being used right now because they over-projected the numbers. Now that press conference was about 50 minutes. I'm going to link to the full press conference below. You got to watch it. There's so much more information. And I just tried to give you snippets. There's so much more. And there's even parts in this press conference where the media asking questions, condescending. Oh, it's horrible. It's horrible. But spread this far and wide, friends. All of America needs to see what these two doctors have to say. Remember, you possess the power. I say it a lot. You possess the power. And your little finger, by hitting share, by sending it in a text message, sending this in an email thread, posting it on a message board. I would say like post to social media, but social media is censoring information. Twitter is censoring information. Facebook censoring information. Thankfully, we're here on YouTube and we can get this message to you. So continue to share, tell your friends. We're going to open up this country. We're going to get through this thing. We're almost out. The data is starting to come through and we're seeing the results. I have faith. I know you do too. We are almost through this. So I'll see you at the next report. For the Next News Network, I'm Gary Franchi.
You possess the power to impact the global narrative. Please share this report, and to get more videos like this, Become the Next News subscriber by clicking the link below. Thank you for watching the Next News Network.
Millions of cases, small amount of death. Millions of cases, small amount of death.
All right, I got some more good news for you guys. The Fauci-Gates pandemic model is absolutely collapsing. I'm getting contacted by doctors all over the country. Of course, you've probably seen the 2 viral interviews I've just done, some of the other investigative work I've done, but now it's all falling apart, folks. 2 doctors from California have just completed a press conference, okay? I'm going to show you some clips from it that completely destroy the narrative. They're talking about what we've been saying all along. Of course, we have to be careful. We have to be concerned. There's nothing wrong with being taking the appropriate steps to maintain our health and to make sure that no one else gets sick. Of course, we don't want people to get sick, but we have to take a look at the actual facts and the numbers, because that's where the real story is. And when you have projected numbers that are creating policy that are destroying lives, it's probably a good idea to look back and double check those numbers to see if we're accurate. And that's exactly what these doctors have done. So I'm going to play a clip here. This is the 2 doctors talking about the rates of infection in California and as well as New York. It's going to blow your mind, but it only verifies exactly what we've been saying all along. And yes, somebody should be held accountable at the highest level at the National Institute of Health. Yes, I'm talking about Dr. Fauci. Listen to this.
So if we look at California, these numbers are from yesterday. We have 33,865 COVID cases out of a total of 280,900 total tested. That's 12% of Californians were positive for COVID. So we don't, as you guys know, the initial models were woefully inaccurate. They predicted millions of cases of death, not of prevalence or incidence, but death. That is not materializing. What is materializing in the state of California is 12% positives. Well, if we have 39.5 million people. If we just take a basic calculation and extrapolate that out, that equates to about 4.7 million cases throughout the state of California, which means this thing is widespread. That's the good news. We've seen 1,227 deaths in the state of California with a possible incidence or prevalence of 4.7 million. That means you have a 0.03 chance of dying from COVID-19 in the state of California. 0.03 chance of dying from COVID in the state of California. Does that necessitate sheltering in place? Does that necessitate shutting down medical systems? Does that necessitate people being out of work?
So think about that question. Has the response been warranted when you look at the actual numbers? How did we react for similar numbers with the flu? Listen to what he has to say about that.
So if this is a typical extrapolation, 328 million people times 19.6 is 64 million. That's a significant amount of people with COVID. It's similar to the flu. If you study the numbers in 2017 and 2018, we had 50 to 60 million with the flu. And we had a similar death rate. The deaths in the United States were 43,545, similar to the flu of 2017, 2018. We always have between 37 and 60,000 deaths in the United States every single year. No pandemic talk, no shelter in place, no shutting down of businesses, no sending doctors home.
That's right. No shutting down businesses, no sending doctors home. Now, he detailed the massive disruption that's taking place inside the health systems in California and how that the emergency rooms are empty. Floors are completely shut down and they're just sending people home. Listen to this.
Severe disruption for accelerated as we have people coming in 7 in the morning till midnight. We're reporting to the health department. We're calling patients back. And at the same time, our volumes have dropped significantly. The hospitals, their ICUs are empty, essentially, and they're shutting down floors, they're furloughing patients, they're furloughing doctors. So the health system has been evacuated in certain places. In New York, the health system is working at maximum capacity. In California, we're really at a minimal capacity, getting rid of our doctors and nurses because we just don't have the volume. The hospitals don't, as I've met with their CEOs twice in the last week, and we don't as well. So,
okay, so this is eye-opening. This is stuff that we've known about. This is stuff we've been talking about. All of this verifies the Stanford study, the University of Southern California study that talks about just how widespread this thing really is. And then he goes into a point about the data itself. He's just reinforcing these facts that need to be shared across America. That this thing is not as deadly as they made it out to be. As Fauci and Birx and Bill Gates, fear-mongering across America, amplified by the media? No. Listen to this doctor now. Talk about the actual death rates.
We're sharing our own data. This isn't data filtered through someone. This is our own data. We found 6.5%, and then California has found 12%. So the more you test, the more positives you get. The prevalence number goes up, and the death rate stays the same. So it gets smaller and smaller and smaller. And as we move through this data, what I want you to see is millions of cases, small amount of death. Millions of cases, small amount of death.
Millions of cases, small amount of death. He wanted to drive that point home because he knows that the numbers are proving Fauci, Gates, and Birx absolutely wrong. He's painting the picture that the response to this thing was completely misguided. Now wait till you hear what he says about the New York numbers and the actual percentages when you extrapolate it out across the entire population of New York and the actual death rate, the percentages. Listen to this.
Let's go over their numbers. Cases of COVID as of yesterday, 256,272 cases in New York State. Not New York City, New York, the entire state. They did a total of 649,325 tests. That's 39% of New Yorkers tested positive for COVID-19. That's their ratios. This is public data online. You can all look it up.
39% of people who were tested.
39% of the people were tested.
39% of New York State.
Right.
39% of New York State is there's 20 million people there would be close to 4 million.
Which is likely, they likely have 7.5 million cases
So I
in New
just want
York.
to make that clarification. It's
Yeah.
not 39% of every New Yorker, it's every New Yorker who's been tested.
Right. So we extrapolate data.
I just want to make that.
We extrapolate data, we test people, and then we extrapolate for the entire community based on the numbers. The initial models were so inaccurate, they're not even...
But in those initial models, a lot of them were based off if we did no social distancing.
Right.
Is that correct? So is it really fair to say, obviously they're not as bad as they were because those were based on alternative scenarios?
And some of them were based on social distancing and still predicted hundreds of thousands of deaths, which has been inaccurate. So in New York, the ones they tested, they found 39% positive. So if that's indicative, and they tested 649,000 people, that's a massive test. That's accurate data, 39%. So if they tested the whole state, would we indeed have 7.5 million cases? We don't know. We will never test the entire state. So we extrapolate out. We use the data we have because it's the most accurate we have versus a predictive model that have been nowhere in the ballpark of accurate. So how many deaths do they have? 19,410 out of 19 million people, which is a 0.1% chance of dying from COVID in the state of New York. And they have a 92% recovery rate. If you are indeed diagnosed with COVID-19, 92% of you will recover. So we're seeing millions of cases, small amount of death. Millions of cases, small amount of death.
And now the doctor compares Sweden versus Norway's numbers because one nation completely shut down, locked down, and the other didn't. Left their economy wide open. And the numbers speak for themselves. Listen.
When you bring up a system of lockdown, you automatically have to compare it to a system of no lockdown. Sweden and Norway. I'm Norwegian.
Norway has lockdown.
Norway has lockdown, Sweden does not have lockdown. What happened in those two countries? Are they vastly different? Did Sweden have a massive outbreak of cases? Did Norway have nothing? Let's look at the numbers.